This video presentation is going to tackle about schizophrenia. The word schizophrenia is derived from the Greek words schizo means split and phren means mind. It is a serious mental disorder that has severe effects on both physical and mental well-being, including a person's thinking, language, emotions, social behavior, and ability to perceive reality accurately. The 5 key clinical features are as follows: delusions, the persistent false beliefs that are not based in reality; hallucinations, perceiving things that are not actually present, such as hearing voices; disorganized thinking, the patient's struggle to organize thoughts; disorganized or abnormal motor behavior. This can manifest as unusual movements or lack of purposeful movement. Negative symptoms. This include reduced emotional expression, lack of motivation, and decreased ability to experience pleasure. Schizophrenia is probably caused by a combination of factors, including genetics, which plays an important role in the development of schizophrenia; neurobiological, the dopamine hypothesis, in which schizophrenia is caused by excessive dopamine activity; physiological factors, including alcohol and substance abuse, birth trauma, head injury, and among others, psychosocial stress, such as childhood sexual abuse, prenatal stress, chronic poverty, and even migration; environmental factors, such as living in urban areas or high crime environments, is also believed to increase the risk for schizophrenia, according to Haddad. The anatomy and physiology of the brain. Using brain imaging techniques called PET scans showed a lowered rate of blood flow and glucose metabolism in the frontal lobes, which govern planning, abstract thinking, social adjustment, and decision making. It is also believed that the temporal lobe is affected, which include the language comprehension, emotional regulation, and memory. There is also a disruption in communication pathways in the brain that are thought to be severe in schizophrenia. Neurotransmission by another calming neurotransmitter, GABA aminobutyric acid, or GABA, is also impaired. And there's excessive dopamine signaling as well. The patient profile. Mr. Eddie White, 23 years old, male, Black American, is renting an apartment in Moscow with a current diagnosis of schizophrenia, paranoid type, with auditory hallucination. His disorder is new onset schizophrenia, having comorbidities with a history of brain tumor, depression, alcohol, and substance abuse. His existing social support is his girlfriend, where they recently got engaged, and he has also a strong family support abroad. The therapeutic communication. In dealing with patients who are having schizophrenia, we have to encourage the description of perception. For example, you have to ask the patient, "Can you tell me what is the voice telling you now?" We also have to present reality. In this example, the patient tells you, "You are a superwoman." As a nurse, you will say, "Mr. White, I am your nurse, Anne, and you are in the hospital right now." The NANDA nursing treatment goal, diagnosis, intervention, evaluation, and treatment outcome. The treatment goal of this patient is at the end of the week, the client will be able to verbalize and identify that voices he hears are not authentic and determine what is reality. With this, the diagnosis is disturbed sensory perception, including auditory and visual. The intervention would be assisting the client to define and test reality. As an evaluation, it will be goal met. By the end of the first week, the client tells the nurse when he is experiencing hallucination. As a treatment outcome, he can tell the nurse that he hears voices that are not real. The second treatment goal is that by the end of 2 weeks, the client was able to cope with the adverse effects of the medication and its importance. Its diagnosis is impaired home maintenance. The intervention will include educate on the adverse effects, how long they last, and what action can be taken. Evaluation would be goal met. 2 weeks after taking medication, the client expresses a better understanding of his medication and what to do for the adverse effects. Treatment outcome: he consistently adheres to the medication regimen, state that he is doing this for his fiancée and is excited to build a family with her. The plan of care to consider. As the patient is having hallucination, we have to implement safety risks, including increased supervision. We have to be aware of the symptoms if it's increasing. We also have to do education teaching in the medicines and focusing on specific reality-based activities and events in the environment, and as well as have family involvement during the plan of care, especially the fiancé. The pharmacological intervention. Medication is usually a typical antipsychotic medication, for example, risperidone, via tablet or IM. We have to teach the patient the following side effects: that there would be hypotension, so we have to check blood pressure before giving medication, to rise slowly to prevent dizziness, and hold on the railings or furniture while rising to reduce falls. Dry mouth, so we have to encourage frequent sips of water, ice chips, and sugarless candy or gum, and ensure adequate fluid intake. Constipation, we have to encourage him to increase fiber intake and use dietary laxative like prune juice. And we have to let the fiancé and him that photosensitivity is also an adverse effect, so they have to limit exposure to sunlight. If and when they go out, they have to wear sunglasses, sunscreen, and sunblock king clothing. There would also be decreases in sex drive. They have to avoid alcohol and over-the-counter medication without doctor's advice. And of course, do not stop the medication without the doctor's advice. So, in discharging the patient, we have to also important to give patient the community support resources. So these are the following community support available in most Joe. So we have vocational, recreation, and social programs located in High Street West, Moose Jaw. Grief support groups at east of Moose Jaw. Mental health and addictions adult clinical service group. And also crisis intervention resources. We have turning leaf support services and resolve, renew, counseling, and consulting Consulting, which is also located in Moose Jaw. So that is all for me. Thank you.